welcome all of you to the new topic, alopecia. Now, how do we define alopecia? Loss of hair is defined as alopecia, and this alopecia can be broadly divided into two different categories. First is non-cicatricial alopecia, and second is cicatricial alopecia. A non-cicatricial alopecia is also referred to as a non-scarring alopecia. Cicatricial alopecia is also referred to as a scarring alopecia because the word cicatrix means scar. The most important point is what are the differences between both of these. We will just discuss the broad difference between non-cicatricial and cicatricial alopecia. So, number one, in relation to their follicles. In a non-scarring alopecia, what happened is hair follicle are preserved, whereas in scarring alopecia, hair follicle are destroyed. Second is, there are no visible sign of inflammation in a non-scarring alopecia, whereas in cicatricial alopecia, visible sign of inflammation like pustules and scaling are present. Scaling are present in cicatricial alopecia, that is responsible for the damage to the hair stem cells and hair bulb. And lastly, if you look at the course of the disease, generally non-scarring alopecia is reversible, whereas scarring alopecia is irreversible or the hair fall in this is permanent. So these are the broad differences between non-scarring alopecia and scarring alopecia. The non-scarring alopecia has better prognosis when compared to scarring alopecia, which has bad prognosis because of loss of hair follicles and irreversibility. Let us first discuss the different causes of non-scarring alopecia. We have four different categories over here. First is patchy, second is diffuse, third is pattern, and fourth is systemic disease. Look at the examples of each of them. Under patchy, we have alopecia areata, trichotillomania, tinea capitis non-inflammatory type, and fourth is a sexually transmitted disease, that is secondary syphilis. Under diffuse, there is anagen effluvium and telogen effluvium. Under pattern, the disease which we remember here is androgenic alopecia. And under systemic disease, we have to remember SLE and thyroid dysfunction. Now we are going to discuss the first cause of non-scarring alopecia, which is alopecia areata. Definition wise, it is a common chronic inflammatory disease characterized by the initial lesion of a circular, complete hairless, smooth patch causing non-scarring form of hair loss. The alopecia areata is an autoimmune disease, and the autoimmunity is going to target the antigen hair bulb. Before we discuss the clinical feature, we will just take a look on what is trichoscopy. Trichoscopy is the examination and analysis of scalp and hair disease by using a dermoscope. Currently, trichoscopy is utilized to assess and diagnose many inflammatory, infective, and tumorous conditions that affect the scalp. Because of its non-invasive nature, it is easy and rapid to do dermoscopy. Although histopathological analysis is the gold standard for the accurate diagnosis. Clinical findings of alopecia areata. Start with trichoscopic finding. Yellow dots. Yellow dots are common trichoscopic pattern in alopecia areata. They correlate with disease severity and are sensitive markers for the diagnosis of alopecia areata. Next, black dots. Black dots indicates active disease in alopecia areata. And other different trichoscopic patterns in various stages of alopecia areata are exclamation mark hair, tapered hair, pole pincus construction. Now, if you look at the margins of the lesion, you are going to have a very important named hair known as exclamation mark hair. This is how an exclamation mark looks, and if you imagine it is in the hair, you will see that this exclamation mark has got two ends. You have the distal end and the proximal end. The distal end is broader and the proximal end is tapered downwards. That's why this is referred to as an exclamation mark hair, which is usually seen in the margins of lesion. Next important point is examination of nails. You can see there are multiple geometric pits here. So this is referred to as a geometric pitting. Depression in the nail plate and the type of pits that you get in alopecia areata, they refer to as fine superficial regular pits. This is the characteristic type of pitting in alopecia areata. Other important features in alopecia areata. Craters of the moon sign. In alopecia areata, as the alopecia patch is devoid of hair follicle, sebum secreted by the sebaceous gland directly opens out onto surface to form a yellow dot, hence forming a depression of extension. Yellow dots resembling a crater of the moon. Next is monolithics like hair. Repeated formation of pole pincus constrictions results in formation of monolithics like hair. Now, another named hair is tulip hair. They differ from exclamation mark hair, where there is light colored hair shaft thinned at the proximal end with the dark bulbous distal end. Next, we go on to the histopathology. We already discussed that the autoimmune process in alopecia areata, which targets the anagen hair bulb, and this autoimmunity, how does it manifest? It is going to manifest in the form of lymphocytes, and these lymphocytes are going to target the bulb of the anagen hair, results in infiltrate around the anagen hair bulb. This is referred to as a peribulbar lymphocytic infiltrate, and this has a very characteristic appearance. It is known as swarm of bees appearance. Now, let's move on to the bad prognostic factor in the patient of alopecia areata. That means when a patient comes to you, what are the points which we should use in counseling the patients to tell him that the prognosis is not very good? Number one, in term of the disease onset, always remember early onset has bad prognosis. That means when you have children presenting with alopecia areata, the prognosis is not very good. Second one is the type of alopecia areata. So there is a type of alopecia areata called ophiasis. In ophiasis, the patient is going to lose the occipital hair. That is a bad prognostic feature. There is another alopecia areata where total scalp hair is lost. That's referred to as a alopecia totalis. And lastly, if you don't take care of this condition, it can wipe out the body hair as well. That's called alopecia universalis. Now, next, if there is associated autoimmune disease, like most probably thyroid dysfunction, and this is also regarded to be a bad prognostic factor. Now, after finishing the topic, let's move on the treatment of alopecia areata in a localized disease.